Welcome to our channel, where we discuss important topics that touch many lives. Today, we're addressing a sensitive subject that affects countless families: miscarriage. Our goal is to provide clarity, support, and understanding. We hope this video offers the insight and comfort you need. Now let's dive into what miscarriage is, its types, and causes. Before we delve into the medical aspects of miscarriage, it's important to recognize the human side of this experience. Miscarriage is not just a medical event. It's a deeply personal and emotional journey. These are real stories from real people, shared with the hope of breaking the silence. I felt so alone, like I was the only one going through this. It was heartbreaking, but talking about it helped me heal. I never knew how common it was until I went through it myself. Each experience is valid, and each emotion is real. By sharing these stories, we hope to offer a sense of connection and understanding. Now, let's move on to understanding what miscarriage is in more detail. While personal stories highlight the emotional journey, it's crucial to address the societal stigma surrounding miscarriage. Despite its prevalence, miscarriage is often shrouded in silence and misunderstanding. This silence can make the experience even more isolating. Many feel a sense of shame or guilt, afraid to share their pain for fear of judgment. Misconceptions and lack of awareness play a large role. By breaking the silence, we can educate and create a more compassionate society. Let's listen to some thoughts from experts and advocates. Insert voice clips of anonymous experts and advocates discussing the importance of open conversations and education about miscarriage. For example, we need to normalize talking about miscarriage, just as we do with other medical conditions. Education is key to breaking down the stigma and supporting those who have experienced loss. These insights emphasize the importance of dialogue and understanding. Now, let's move on to understanding what miscarriage is in more detail. Experiencing a miscarriage can be an incredibly emotional and challenging time. The grief and loss felt can be overwhelming, and it's important to recognize and validate these feelings. Everyone's journey through this pain is unique, and there is no right or wrong way to grieve. Some may feel sadness, anger, or guilt, while others may experience relief or numbness. It's crucial to allow yourself to feel and process these emotions without judgment. Seeking support is a vital step towards healing. This can come from friends, family, or professional counselors who can provide a safe space to express your feelings. Joining support groups, either in person or online, can also be incredibly beneficial. Self-care is another essential aspect of coping with the emotional impact of miscarriage. This might include activities that bring you peace and comfort, such as yoga, meditation, or creative outlets like writing and painting. Remember to be gentle with yourself and give yourself permission to take the time you need to heal. Healing is a journey, and it's important to acknowledge that it may take time. There will be good days and bad days, and that's okay. By taking small steps towards self-compassion and seeking support, you can gradually find a way to move forward. Let's now delve deeper into understanding what miscarriage is and the factors that contribute to it. Moving forward after a miscarriage can feel daunting, but seeking support can make a significant difference. Reach out to family, friends, or professional counselors. Sharing your experience can ease the burden of grief. Support groups offer a safe space to share and listen. They provide comfort, understanding, and practical advice. Consider professional help if you're struggling. Therapists can offer personalized support and coping mechanisms. Focus on self-care during this time. Engage in activities that bring you joy and relaxation. Take care of your physical health. Healing is a process. Take it one day at a time. Surround yourself with supportive people and resources. Let's now delve deeper into understanding miscarriage and its contributing factors. Miscarriage is the loss of a pregnancy during the first 20 weeks. It affects about 10 to 20% of known pregnancies. It's not your fault. Most miscarriages happen in the first trimester. The most common cause is a chromosomal abnormality. Miscarriage can be very emotional. Seek support from loved ones or support groups. Many women go on to have healthy pregnancies. There are different types of miscarriages. A threatened miscarriage involves vaginal bleeding with a closed cervix. An inevitable miscarriage includes bleeding and an open cervix. A complete miscarriage occurs when all pregnancy tissue has passed. A missed miscarriage happens when the embryo stops developing but remains in the uterus. Signs include vaginal bleeding, cramping, and abdominal pain. Some women may also pass blood clots. Chromosomal abnormalities are the most common cause of miscarriage. Other factors include maternal health conditions like diabetes or thyroid disease. Advanced maternal age is also a risk factor. Coping with the emotional impact. Miscarriage can be emotionally devastating. Allow yourself time to grieve and heal. Don't blame yourself. Talk to your partner, family, or friends. Consider joining a support group. Consider seeking support and moving forward. Follow up with your healthcare provider for a checkup. They can guide you on when to try again. Healing takes time. Be patient. Lean on your support system. Seek professional help if needed. With time and support, you can move forward.